Hello and welcome. My name is Luke Herbert. I'm Pharmacy Director at KSB Hospital, and with me is Gabe Billiet, Pharmacist at KSB. Welcome, Gabe.
Thanks for having me.
And we're here via invitation from KSB Community Wellness, and we're happy to share with you tonight a little bit of information about some of the newer weight loss therapies out on the market.
Specifically, we're going to be talking about probably what you've heard the most in the media right now, the GLP-1 weight loss injections. These are a newer type of medication, really have become popular in the last few years, or last several years, I should say, specifically for weight loss. But before that, we've had these around for quite a bit, originally used for diabetes.
Absolutely. So several years of experience with diabetic patients. Started to see approvals probably a little more than a year ago or so for weight loss. We've seen more and more people on them. And like Gabe said, you've seen a lot in the media, social media, people taking these medications, for weight loss.
So kind of a complex subject, but we're going to just try our best to kind of skim through it briefly tonight, just to give our community a little bit of kind of background behind these medications and what they can kind of expect and what they should know about it. So how do these medications work, Luke?
So these affect the GLP-1 hormone that we already have in our body. It helps regulate appetite, insulin production. Definitely very much related to blood sugar control, and so it's important in diabetic, all of us, but in particular diabetic patients, and that's why the medications were used in diabetic patients. So the medication basically mimics the hormone GLP-1, and basically for all patients, but patients who are trying to manage obesity and trying to lose weight, the medication kind of the hormone creates a feeling of fullness, down gastric emptying. So it kind of reduces your craving for food, makes you feel fuller faster, essentially. And it also kind of helps your body to secrete more insulin when you do eat, which is the primary benefit, one of the benefits related to managing diabetes.
Yep, we've got a very long history of these in our diabetics, actually, for add-in therapy just to help improve that glucose control. And patients that were on these medications, we saw a moderate weight loss with them. In the last few years, they've kind of managed to but they managed to adjust it in and fine-tune it, and we've started to see a lot bigger weight loss with it. On there, besides that improvement in blood sugar control, like we talked about in our diabetics, we're also noticing now a reduction in risk of cardiovascular events, which is associated a lot with obesity. Let's talk a little bit about some of those health risks of obesity, Luke.
I'm sorry. So, yeah, being overweight is a big risk factor for hypertension, for high cholesterol disease, for cardiovascular disease, heart attacks, potentially stroke, and for liver disease, and really a long list of diseases. Being overweight is a big risk factor for the incidence of several diseases and poor outcomes.
So anything we can do to reduce that is just going to improve our overall health. Now, some of the examples of these medications, like I talked about, they've been around for several years. The next slide is going to show you some of the more common name brands associated, with this category of medications. Our older ones, such as Saxenda or Trulicity, we primarily use those in diabetes. Saxenda did get a weight loss indication for it with some modest weight loss with it. But really where the media has kind of taken over is when it comes to Ozempic and Wegovy, and now Mounjaro and the newly approved this year, the Zepbound. So the benefit to these newer ones are the weekly injection versus the daily injections we have with some of those older category of medications, and much greater weight loss seen with them as well. The next slide, or this slide, talks about it's a very simple injection with these, just right into the subcutaneous or that fatty layer, so not very painful at all. The newer ones tend to be injected once a week now versus the older, like I said, which were daily. And it also just depends too on, somewhat of our indication, about dosages, but we'll get into that a little bit, I think, farther on.
And it'd be good to hit on too, like, so for these meds are groundbreaking. They're kind of a game changer. We've been looking for medications that had a significant impact on obesity and the ability to lose weight and weight loss for a lot of years. And so these meds are a game changer for sure. We for all of time, the number one treatment for weight loss is activity, exercise, and your diet, right? And absolutely, those things don't go away. So those lifestyle changes are still critical, really important to, in a healthy way, lose weight and have the best possible outcomes overall for your health.
We mentioned before that part of the benefit to this is that it slows down your GI tract and it leaves you feeling fuller longer. Well, that can lead to the majority of some of these side effects here. What have you seen when talking with patients, Luke?
Well, I think nausea primarily, some diarrhea and constipation are common, especially when you start or when you increase the dose. The side effects on the other side are fairly rare. You're not going to typically see that, but pancreatitis, kidney problems, and potentially allergic reactions can occur. Again, those are all pretty infrequent, unfortunately.
Right. And some of those rare but serious side effects, those can be, with obesity as well. So we've got to kind of just specify that too. But we like to mention those just because it's things that patients need to be aware of when considering what therapy options are out there for them. Now, for the common side effects, Luke, what would you usually recommend to folks that are having issues with like that nausea issue?
So it's kind of expected, I guess, to some extent with the medication because it does slow movement of food as you eat through your GI system. It's going to feel fuller faster, but definitely smaller meals, potentially even more frequent smaller meals will alleviate a lot of those side effects.
Yep. And I always recommend to patients too is limit your fat intake. Fat is responsible for a lot of nausea, especially when we're slowing things down a little bit. Increasing protein is always good. Increasing fiber can also help a little bit with some of those GI complications of diarrhea or constipation. Plus fiber leaves you feeling fuller longer too.
So in general, these medications, as we've seen, are relatively safe. If you have a history of thyroid cancer, there's some risk of that with these medications. These medications may be avoided, in those patients. Any sort of severe, certainly anatomical gastrointestinal issues exacerbated by these medications. So it's definitely, it's going to be a conversation with you and your provider if these meds are a good fit for you, and maybe in particular, which one of these medications is the best fit for you?
Sure. It just reemphasizes that whole communication with the doctor or your prescriber is so important. Making sure they know the family history, not just your immediate family, but even extended family a little bit in some of these cases. Making sure that your doctor knows about any medications that you're currently taking. That can come into play as you lose weight. Some of those medications need to be adjusted to compensate with that weight loss.
So, and not so much clinical side effect, but a consideration with these medications, just understanding that they are very expensive. They can, if someone was paying cash for these medications, the cost could exceed, easily $10,000 to $12,000 per year. To be on medications. There's copay cards. There's other assistance out there. So most patients don't pay that, but it is good to understand from the perspective of getting the medication approved through your insurance and likely having to reauthorize the medication after 6 months or at least on an annual basis, because the very substantial cost of the medication, prior authorizations for insurance and so forth are going to be kind of a big component of staying on this therapy and being successful with it.
Yep. And coverage will vary from insurance plan to insurance plan. For example, patients over 65 that are on Medicare, Medicare will not pay for weight loss medications. And so, again, something just kind of consider before talking to your doctor about these medications, would be, does your insurance cover it in the first place? And sometimes it could be with that PA or a prior approval that Luke had mentioned, and sometimes just not going to be a covered service.
And that's probably going to evolve. So we've looked at the medications, but certainly that's going to evolve with time as we get more data. We've seen more recent data on cardiovascular outcomes, and as more of these medications potentially become available, and hopefully the costs of the medications will come down then.
Okay.
It's certainly going to evolve with time.
Now, who would you say are the best candidates for this medication? Who's going to benefit the most from it?
So these are studied for and approved in adults with a BMI of 30 or more, or folks with a BMI of 27 or more if you also have another condition that puts you at risk. So hypertension, type 2 diabetes, and a list of other conditions.
One of the important things I'd like to say is that, as this slide kind of shows here too, is that these medications are not intended for cosmetic weight loss. We all want to lose a few pounds here, a few pounds there, but these medications are aimed at those where their obesity or their weight is putting them at risk of adverse health occurrences, heart attacks, strokes, high blood pressure, things along those lines. So just something to keep in mind there too.
Absolutely. And I should reference BMI as body mass index. So that's just a calculation based on weight and height. It's not perfect. It's essentially a screening tool. So those numbers are something that your provider can get for you based on when you go to the office and they check your weight. But they may also look at, there's some folks with a high BMI because they have a lot of muscle mass. So that number isn't really the same in everybody.
All right, so we get lots of questions about these. As we mentioned, the media loves this medication. The celebrities love the medications. But these are some of the most common questions that we have received, regarding the medications.
So typically, the first one, can you take this? You wouldn't really start some of this when you're pregnant, for sure. I mean, I think they're not indicated for pregnant, but speak a little bit about somebody who may possibly become pregnant while they're on this medication, or if you're considering this medication.
Yeah, certainly. We have very limited animal models that have shown that in animals, at least, these medications can cause harm to fetuses. And so we want to try to avoid pregnancy while you're on the medication as much as possible, using birth control, maybe even a backup birth control method if you're on an oral contraceptive when you first start the medication, or when you have any kind of dose increase, would be beneficial as well, just to limit that risk as much as possible. So this question is probably most important, is because we do see a lot of younger females on this medication. And so we just want to make sure to put that out there that if family planning is something that is on your mind, make sure to discuss that with your doctor.
And I really like question number 3, because I think it's important to discuss up front what happens if I stop taking this medication. We know that typically the weight comes back. So it's important to understand that these are long-term medications. And when people went off the medications, after as long as, a couple of years or more, the weight does come back.
Yep. I know that there was one study that looked at some patients that gained 14% of the lost weight back again. And you'll hear discussions among patients, patient stories, talking about how, they had problems finding the medication, they stopped the medication, and they gained a lot of weight back. And that just reiterates the importance of using this as just one tool in our arsenal for weight loss, not neglecting or minimizing those therapeutic lifestyle changes, that good diet, that increased exercise as well.
And the final question about long-term risks, I think it's important to reference these medications have been around for a little while, particularly for diabetic treatment and therapy. But we're really just seeing them used on the scale that they're being used right now for, really for less than a year, with so many people using these medications for weight loss. So there's potentially that we're going to learn more about long-term side effects and risks as we go forward over the next couple of years.
Yep. And again, communication with your prescriber is probably the best thing, in minimizing these risks. Making sure that they're monitoring your weight, your blood sugar levels, things like that, so medications can be adjusted with it. Monitoring your kidney function, monitoring you for signs and risks of pancreatitis. Some of those are things that we kind of know about, but just keeping in communication with your prescriber is going to be your best way to address those long-term risks.
Absolutely. And so just to kind of wrap things up, I think it's worth saying one more time, these medications are one tool. They need to be used with effective diet management and change, and with exercise. And exercise in and of itself, regardless of how much exercise, is a critical component of long-term health. And so, lack of exercise or a sedentary lifestyle in and of itself is a significant risk factor for many of the same, things like blood pressure, cardiovascular disease, and diabetes. It's as important in and of itself as weight
Yep.
management.
And that's one thing I caution I let my patients know too, is that as that weight's coming off, some of these barriers to exercise could be alleviating as well, could be getting better for you. So as that weight comes down, try to walk a little bit farther, try to, do a little bit extra, take advantage of that weight loss as it's occurring, that extra energy, that we can sometimes have from that increase in, in weight loss itself.
Thank you, Gabe. Thanks for jumping on with me tonight. Thank you, KSB Wellness, for having us, and I hope you all have a good night. Thank you.
All right. Take care.